Hi, my name is Arj and I've been providing dental implant treatment for over 15 years. And quite often, patients can be confused about what exactly a dental implant is. So let's run it through. So when we talk about dental implants, they're really there to replace any teeth that you may be missing or you may be about to lose. So it's a form of tooth replacement. The components of a dental implant, and we'll talk about a single implant to begin with, it comprises of three main parts. So you've got the tooth, the crown, which is what you're really after. That can be called a cap, a crown, or implant tooth. Then you've got the actual screw, the implant itself, which sometimes is known as an implant root. And then thirdly, you need a way of connecting the implant itself, which sits in the bone, with the crown, the tooth that you're after. And that's done by using an abutment, a connector. These three components joined together will deliver you what we call a dental implant. So we've talked about a single missing tooth. Implants can also be used to replace several missing teeth also. Now it's important to remember you don't always necessarily need to have one dental implant to replace one missing tooth. So if they're all adjacent to each other, the missing teeth, it can be possible to place an implant at either end of the space and to have an implant bridge fitted over the top. So it all really depends on where the teeth are and what your personal situation is. In this example, you can see a patient had a front bridge which was supported by their own teeth, which failed, so it broke off, and in this photo you can see the broken roots of that tooth. Nothing could be done to reuse these natural roots, so they had to be removed, and that led to three missing tooth gap at the front. Instead of placing three dental implants, we've placed an implant at either end of the gap, and we've used an implant bridge that's been fitted over the top. As you can see, when the bridge is fitted, you cannot really tell how many implants are there supporting it, and it looks pretty nice and natural. Finally, implants can also be used to secure loose dentures. Now, generally speaking, the upper dentures pose different issues to lower dentures. With upper dentures, quite often they work by surface area being in contact with the roof of the mouth to stay stable. The downside of having your palate covered with a denture is that it can affect your taste and your speech. So implants can be placed a minimum of 4 for the upper jaw, and the benefit of that is the implants can be used to support the denture itself, so we don't need to have the palate covered, because it's quite often on the palate that there are the taste buds that give you the enjoyment for when you're tasting your food. With lower dentures, because there is the tongue in the way, there is less surface area for the denture to sit onto the jawbone, and quite often most patients will report that lower dentures are quite loose. So the entry level for implant treatment for lower dentures can be to place 2 implants towards the front of the lower jaw, and that can be used to help connect a denture onto the top, as you can see in this example. Just to summarize, implants are a really good option, and it's very important for you to understand what the components are, how many implants you're having done, so you can truly understand your treatment for you. Now, every patient is different, so do have a chat with your dentist, or you can find us and we can run you through your options also.